This is the second video in which we will talk about Wikiparkpedia, our internal Wikipedia. Still no like, share, or subscribe buttons. If you haven't watched the first video titled The Patient Experience Cycle that explains the evolution and the components of the patient experience cycle in greater detail, I suggest you watch it first. As discussed in that video, the diagram on the left represents the patient experience cycle, a model that contains every task and every function in a dental practice with the purpose of providing the best working environment for all of us and the ultimate experience for our patients. To the right is our internal Wikiparkpedia, our password-protected internal platform. We use Wiki because it is a format that most people are familiar with. It's so exciting. Okay, maybe sitting in front of a computer screen isn't the most exciting thing to do, and neither is writing and studying protocols, but there is a method in this madness. This is the first step. We need to first agree on the protocols before we can start training on them. Okay, let's address the elephant in the room. Is this a necessary evil? Is it a time waster that takes you away from meaningful work? Or is there value in it? We have done well so far. Why can't we just do the job learning we've always done before? The new people will learn from the old people, the veterans through osmosis. That's what everyone else seems to be doing and it's working. Valid point. The question is, who do we want to compare ourselves to? The dentist down the street or the dentist who is the leader? If we continue to do what we've always done before, why should we become any better at it? If we are doing everything that we have done before while others are getting better, doesn't that mean that we're falling behind? If we want to remain leaders, we need to do what leaders do. I like to take a look at the most successful and futuristic dental practices. There is a conference in Dallas every year where all the big successful dental corporations attend, share, and discuss their plans and strategies. There are less than 10 Canadians out of 800 attendees. All the big corporate guys were there, the CEOs of Shen, Dentistry, and other people who are in the business of growing dental empires. In a couple of days, you become so pumped that you could feel like you could walk through a wall. Then you look at the dental practices in Canada and feel like you've traveled back in time. There is a lot I can talk about the future of the business and dentistry, but I'll save that for another presentation. The relevance here is the presentation is on-the-job training will only take us so far. If we want to remain leaders, we need to do what leaders do, which means being ahead of the curve, which means having a system that allows individuals to learn and advance. Here's a couple examples of how most dental practices are doing. And here are a couple of the big dental corporations, Heartland Corporation and Aspen. They have their own education centers, their own training platforms for all their team members, from the co-op placement to office managers, hygienists, dentists. They're all in an ongoing continual training mode. In Canada, this is still relatively new, but in the next few years when the US big boys enter and penetrate the Canadian market, which they will, we will see much more of this. At Dental Park, we don't want to replicate what they do. It is good to observe and learn, but we have our own brand and our own vision. Being a big, profitable dental corporation with multiple locations is not our goal or our vision. We want to provide the best experience for all of us and our patients. If we're not enjoying what we are doing, then we know we're doing something wrong. I want to focus on another company that we all know that I feel is more aligned with who we are and who we aspire to become. When it comes to providing an ultimate experience, arguably there is no one better than Disney. Disney has created a magic world with just a pencil, paper, and a dream. Disney works towards perfecting every aspect of that experience, and they have made the delivery of that experience into a science. Disney has the entire client experience mapped out from beginning to the end, drilled into the most minuscule detail. Then each of these details is engineered to perfection. Everything you see, touch, feel, hear at Disney is there for a specific reason. Not only that, Disney never stops improving. They're always on the top of evolving needs for their clients. They anticipate what they could potentially do and come up with the solution. They anticipate problems before they could occur and come up with solutions. Disney is by no means perfect, but they chase the perfection and they distance themselves from the competition. Let's talk about the thousands of Disney team members, the people who interact with the end user and their role in that experience. From the person at the gate checking the passes, the person sweeping the sidewalk, the ride operator, the lady selling the ice cream, or the person behind the Mickey Mouse mascot. While their jobs are different, most of those jobs seem very straightforward. They need to be friendly, they need to know how to count money, and operate a merchant baking machine. There's not much more training that they need to do, right? Wrong? Disney even has their own education institutions, not one, but two of them, the Disney University and the Disney Institute, to teach employees and everyone else who wants to learn about the aspects of Disney and provide them with the training to deliver the experience to the visitors. And do you know what employees are called? They are not staff. They are a team, and they are called cast members. Disney is a complicated business organization with many moving parts, and there is a myriad of procedures, protocols, and a complex network of touch points contributing to the overall experience. While it could be silly comparing our dental practice to a company that has a revenue of almost over 30 per second that provides as many jobs as all the employers in London combined, it is interesting to look at Disney as the measuring stick for a successful, complex, client-centric experience structure and see how it compares to ours. But how complex is a dental practice? How complex is Dental Park? What if someone told you that a dental practice is the most complex small business? Let's think about it. Let's think about it from Dental Park's perspective. Combination of River Park, Victoria Park, and Oasis Park. It may not seem very complicated if you look at it individually, but if you were to look at it collectively, there are a lot of things. And given how many ways there are to do everything in a dental office, you'll quickly realize how sophisticated and complex a dental practice really is. A big reason why dentists in dental practice struggle is because they underestimate the complexity of a dental practice. Let me explain. Dental Park is a combination of 18 distinct standalone businesses, each sophisticated in their own ways, unified under one umbrella. 1. It is a place where you deal with patients' health, just like your family doctor. It is a hospital where you perform surgeries, a walk-in clinic for emergencies, an aesthetic and cosmetic studio, a hygiene clinic, a whitening center, a denture clinic, a dental laboratory, a cosmetic surgery clinic, a CT scan, a radiology clinic, a whitening center, an ortho office, a periodontist, an endo practice, a child-friendly pediatric center, a holistic dentistry refugee, a geriatric dental center. These 18 businesses are scattered among 3 practices, and unlike any Tim Hortons or McDonald's, each of our practices is very distinct in size, procedures, geography, and type of patients. Let's talk about the services. In the 2020 GP fee guide, there are 1,308 codes. We don't use all of them, but you have to have a pretty good knowledge to know which ones to use. And there are other codes that are not in this guide. We use not 1, not 2, but 3 feed guides. We have a specialist feed guide, and we have a very small number of patients on social assistance. A dental experience has over 250 touch points. A touch point can be defined as any way a consumer can interact with a business, whether it be person to person, through a website, an app, or any form of communication. It could be when they make a call, they see our website, meet one of our team members, get a tooth pulled. These are all unique events or touch points. The experience at the end is the sum of these positive or negative touch points. If you think about how many touch points exist between when the patient first searches for us, to scheduling a visit, to coming in for a consult, COE, hygiene visit, gets his pre-descent, comes back, gets the work done, gets everything until their next appointment. These 250 touch points the patient experiences are comparable to a family going on a Disney cruise or to a Disney resort. A dental practice has no shortage of dangerous touch points. Dangerous touch points are defined as touch points that are at high risk of providing a negative experience. While there are a lot of things that can go wrong in a Disney cruise ship or a resort, there are a lot more that can go wrong in a dental setting. Clinically, and at any point as we pass through the 250 touch points. Risk. Every patient has an element of risk. There is a clinical risk associated with the procedure not done correctly. We are seeing patients who are old and medically compromised. We are sedating them. There is even a risk a patient could die. Every patient is a potential lawsuit. If we did everything correctly, they can sue us. Or they can make life impossible by filing a complaint with the RCDSCO. There is a risk of infection. You come very close contact to a patient who can have possible infectious disease. You have to have sterilization and infection control protocols at the highest standards. And all of this before COVID. Stimuli in psychology means that something that causes a response. It is a filter through which we see our experience. A Disney cruise, a nice, beautiful sandy beach on a warm day, it triggers positive stimuli. A 5-star resort, a spa, Disney World, an exclusive restaurant, all have positive stimuli associated with them. These are the positive connotations that put you in a good mood. So as a business, you are catering to people who have chosen you because they want to be there. They are happy, excited, and it makes it so much easier to provide a great experience. You really have to screw up or undeliver in many of these areas for a client to have a bad experience. Negative stimuli is the opposite. The 3 most negative stimuli are fear, pain, and high cost. If you're afraid, you're nervous. You're not enjoying yourself. If you're in pain, well, you know the answer. If you have to sink a lot of your hard-earned cash rather than spending it on something you would much rather prefer, you're definitely not going to have a good attitude. Well, a dental visit has all 3 negative stimuli, and now we wonder why people say they hate going to the dentist. What other personalized service has these 3 negative stimuli? In order to provide the experience we described in the previous 2 slides is pretty easy, as long as we have the 25 hard and soft skills needed and the expertise in 15 professions, not counting the obvious ones: dentistry, hygiene, lab, sterilization, radiology, dental assisting, medicine or pharmacology, because although we don't dispense drugs like a pharmacy, we need to make sure the prescription is done correctly. If we screw up, another potential risk and liability. We can spend the next 15 minutes lifting off the sub areas, but I will skip these and move on to another 15. We need to be great communicators, each and every one of us. We need to be great communicators in virtually every communication media: face-to-face, over the phone, email, text, social media, recall max, chat. Amazing salesperson to convince the patient of treatment. It is a business. Unlike the hospital, people need to pay out of pocket, and dentistry is the most expensive on average of what Canadians saves. If we can't communicate and convince the patient, our superstar dentists or hygienists have no chance on showing off their skills. You have to be an expert in internal and external marketing, social media, websites, Facebook, etc. And then you have to be an aspect on all the RCDSO marketing rules, as most marketing rules are prohibited and the penalties are harsh. One write-up in the dispatch and you're doomed. A professional photographer. A picture tells 1,000 words. We need to be able to operate a camera, a video camera, and take pictures of not only people, but of their teeth with a camera and a scanner. A dental benefit expert. You deal with benefits, and there are tens of thousands of different plans, their combinations and permutations, and you have to have a good idea of how they work and all the tricks in the trade to help our patients get paid, so you have to be a dental benefit expert. Knowledge of quick mathematics is essential when discussing fees. Knowledge of finance and banking is also extremely useful when helping to coordinate financing. You need the skills of a collection agency when chasing people for money. Understand confidentiality, informed consent, the legalities of privacy breach, PHIPA, PIPEDA. Speaking of RCDSO, you need to know a binder of these rules so that you keep patient information safe. People associate dentistry with pain, fear, and high costs. No wonder they don't like dentists. This makes your job of making the patient experience so much harder. So you have to be a good host, be compassionate, understanding, and at the same time be strong, affirmative, direct to collect their hard-earned money. You need to take notes. You communicate verbally, by text, by email. So you need to not only be a strong writer, but an experienced writer and be able to think on multiple levels, as one word or one sentence can make a difference between a happy patient and a lawsuit. Knowledge of foreign languages is a bonus, as sometimes the communication occurs in multiple languages. Patients share intimate information, and you are expected to be a marriage counselor, a guidance counselor, or a private motivator. You deal with people in fear, pain, and who don't have the money, and you have to manage their unrealistic expectations. You need to be able to deal with upset patients. The patients share lots of information with you, so you need to be a good listener and a psychologist. At the same time, be an expert in legal matters, patient confidentiality, so that you accidentally don't mess up. You need to be an expert in technology, hardware, and software. A modern dental practice is an integrated technological system that provides dental service. Don't believe it? Well, how can a dental practice function when power's cut off? Most practices can't work if they lose internet connection. So yes, you need to be pretty well versed in technology. Considering how much technology and equipment we use on a daily basis, it is at the level machine operators use in a factory. You need to know how to make coffee, be a great tour guide, and ensure in the winter the ice on the sidewalk has melted. You need to be a good actor in the sense that you need to smile and be nice to people who may not be nice to you. Now that we've covered what it takes to make patients happy, let's talk about your environment and the team. After all, our superheroes are working as part of a team. Every dentist is different and has their own way of how they would like to have things done. Each team members are so different in every way. Different educational backgrounds, language, culture, experience, knowledge, skills, age, goals, aspiration, and pet peeves. And all of this complexity happens in accelerated space when patients who are already subject to 3 strong negative stimuli, pain, fear, and dollar signs, in a space that is usually smaller than a tennis court, and in some cases, half the court. In the light of this complexity, we are expected to fuse magically together into a cohesive team and provide this uniform, phenomenal patient experience across the 250 touch points in a consistent, sustainable way. And to do this without any training, you need to practice and train for every sport, for every activity, for every profession. Sure, every performance, every game is a valuable experience that makes you better, but every team, every athlete will not go very far if the only training and learning they do is during their game performance. What other small business is more complicated than a dentist practice? I don't know of any. The question is then, why are dentists not doing it? There are for a number of reasons. First, in the past when dentistry was a simple business, that was not something that was needed. Necessity is the mother of progress. All dentists were making money, and the business of dentistry was much simpler. There was not any need for this. They could do the minimum necessary and still be rich. A lot of these dentists who were able to build up a successful practice just rode the wave, and some are still riding this wave. As a result, the industry does not have the culture of training. The best proof for this is you have mandatory CE requirements, points in different categories that you are obligated to take. As the business of dentistry becomes more competitive, dentists are increasing their continuing education, but still for the most part limited to the clinical aspects. Second, training is very expensive. It takes time, effort, and is difficult to do it well. Dentists don't see it to the degree of complexity presented here. If you think what it costs to pay a consult to come in, the employee's time, and most important, if you're training, you're not seeing patients, so you get hit twice. You're spending money and you lose hours or days of production. It costs between $5 and $10K per employee or person and associate per year to do it well. For a practice of 20 people, that's $200K a year. Most dentists are not willing to spend that amount of money. And even if they do, it doesn't guarantee success. If they're not able to implement and they lost the money. Another big reason is that they are more qualified employees are more expensive to maintain. They are more marketable, so you have to pay more for them or you will lose them. Now you have to spend more money on searching, rehiring, and retraining. Better trained associates are more likely to leave and start their own practices. When that happens, you will lose some patients. And now you have to find a new associate with the hope that they are as good and you don't lose any more patients. Therefore, dentists prefer to train and keep their associates and team members grounded. Give them a little more training so that they become more valuable to the practice, but not too much so that they don't ask for more money. At our practices, we always believe that investing in our team members is the best investment you can make. People want to stay with us because they are a better fit for what they're looking for, not because they can't find a better job. Most dentists would not agree with us. For the few dentists who do agree with us and subscribe to our psychology, have another challenge. They would like to do it, but they can't afford to. And then the very small segment of dentists that agree with this and continuing learning, are able and willing to spend, need to think of the effect it will have on the practice value. You see, there is a paradox. Every dentist will agree that a strong, cohesive, well-trained team, and by team I mean everyone including the associates, is worth the earth and the sky. However, when it comes to paying for a practice that has a great team, they are not willing to pay for it. Dental Strategy last year did more practice valuations in Ontario than any other company. We also help dentists on the buyer side to look at appraisals from other companies. We have been involved in over 100 transactions over the past 3 years, and in all cases, a strong team is seen more as a liability than an asset. How does that make any sense? Because it is very difficult for the purchaser to measure how good the team is, but it is really easy for someone to read financial statements. If you have 2 practices and each of them earn $1 million, one has staff costs of $8K and the other is seen as an efficient practice. On the other hand, if you have $1 million practice with HR costs of $300 or $400K because you spent $100K on training, it is seen as inefficient practice with overpaid employees and is a red flag for the buyer. And because most dentists don't see the world the way we do, it is difficult and on the verge of impossible to convince them that a practice with a great team is worth more than one without it. So there you have it. I won't change their culture or mentality of this industry, but the 200 mil, 500 mil, and the 1 billion big boys from south of the border will. Until that happens, we'll just take advantage of the other dentists that don't see.